When you think of a hospital, you think of a place for healing, right? A place to get better. But what if that very environment, the one designed to heal you, actually carries its own hidden risk? Today, we're going to dig into that paradox, the one at the very heart of modern healthcare, the danger you can face after you've already been admitted. It really is one of the strangest ironies of modern medicine. The one place you go to get well is also a place where you can, unfortunately, get sick. And we're not talking about medical errors here, but about an invisible threat that just thrives in these kinds of settings. So that begs the question, right? Can a place of healing actually make you sicker? It's a tough thing to wrap your head around, but the answer is a stark reality in healthcare. The answer is yes. And this whole phenomenon, it has a name, a hospital-acquired infection. Okay, so what exactly qualifies as a hospital-acquired infection, or an HAI for short? Well, it really all comes down to timing. An HAI is defined as an infection a patient gets at least 48 hours after they've been admitted. That 48-hour clock is the key. It's how doctors can tell the difference between an illness someone already walked in with and one they picked up inside the hospital. Now, you might be thinking this is just a risk for patients, right? But the circle of exposure is actually way wider than that. For hospital staff, this is a real occupational hazard they face every day. And yet, even visitors, the friends and family sitting at the bedside, they can be exposed too. It's a threat that really affects the entire hospital ecosystem. So just how widespread is this invisible threat, really? Well, the numbers, they might just surprise you. Check this out. A World Health Organization study in Southeast Asia put a number on it, and it's a staggering 10%. 10% of hospitalized patients will get at least one HAI. To put that in perspective, just picture any hospital ward with 10 patients. On average, one of them is fighting off an infection they didn't have when they first arrived. And get this, that 10% is just the average. Depending on the hospital, the kind of procedures they do, and how vulnerable the patients are, that rate can totally skyrocket. In some high-risk units, it can be as high as 50%. That's basically a coin flip. And that's exactly why a hospital's infection rate isn't just some number on a spreadsheet. It's a direct reflection, a report card really, on that hospital's quality and safety. It tells you exactly how well a facility is protecting the people inside it. Plain and simple, a lower rate means a safer hospital. Okay, so how do these infections actually spread? To stop them, you've got to understand their pathways, how they get from point A, the source, to point B, a person who can get sick. Well, the tricky part is the sources are literally everywhere. Germs can be carried by other patients, they can be unknowingly transported by staff, moving from room to room, or they can just be lurking on surfaces we touch all the time and assume are clean, things like bed rails, door handles, even the TV remote. And once they're out there, these germs have a few favorite ways to get around. The number one way? Direct contact, and that usually means hands. But they also spread through tiny droplets from a cough or a sneeze. They can float through the air on dust particles, and they can be introduced directly into the body through contaminated medical items, like IV lines or catheters. So I know this all sounds pretty serious, and it is, but here's the good news. The defense against it is surprisingly straightforward. It really all comes down to prevention, and the strategies we're about to talk about are things everyone can be a part of. First things first, let's clear up two words you hear a lot: disinfection and sterilization. They sound similar, but they are worlds apart. Think of disinfection like wiping down your kitchen counter. It kills most of the germs, but some of the really tough ones might survive. Sterilization, on the other hand, is like putting that counter in a pressure cooker. It eliminates everything, all microorganisms, even the super resilient bacterial spores. And that's why it's absolutely critical for any tool that enters the human body. And that, of course, brings us to the single most powerful weapon we have in this fight: good old-fashioned hand washing. But it's way more than just a quick rinse. As you can see here, the correct technique is a whole systematic process. It's designed to clean every single surface: your palms, the backs of your hands, between your fingers, even under your nails. But it's not just how you wash your hands that matters, it's for how long. A truly effective hand wash takes a full 40 to 60 seconds. Seriously, if you need a timer, just sing happy birthday to yourself twice. That usually does the trick. Okay, beyond our hands, let's talk about PPE, or personal protective equipment. Putting it on, which is called donning, has a very specific order for a reason. The whole idea is to create a complete barrier, moving from the biggest items to the smallest. So you start with the gown, then the mask, then your goggles or face shields, and last but not least, the gloves. Now, taking it all off, or doffing, is arguably even more important because this is where you can accidentally contaminate yourself. The logic here is simple. Get the dirtiest stuff off first. That means your gloves are the first to go. Then your goggles and gown. The mask is the very last thing you remove, which minimizes your exposure right before you guessed it, clean your hands again. So you see, this whole thing isn't just on the doctors and nurses. Whether you're a patient or just visiting someone you care about, you are a critical link in the chain of safety, and you have a real role to play in all this.
And here's what you can do. These are 4 simple but incredibly powerful actions. First, just be obsessive about washing your hands before you go in a room and after you leave. Second, and this is a big one, if you're sick, please stay home. Postpone your visit. Third, pay attention to the signs and follow the hospital's rules. And finally, you have every right to be an advocate for your own safety. A simple, polite question like, "Excuse me, did you have a chance to wash your hands?" protects everyone.
So we've gone through this huge, complex, invisible threat. But isn't it interesting that so often the most powerful solution turns out to be the simplest one of all? In a world of incredibly high-tech medicine, could it be that the most important life-saving tool we have is still just a bar of soap, some clean water, and about 60 seconds of our time?